Hello everyone and welcome. My name is Nancy Glennon and I am the Information and Communications Technology Specialist here at DECA. This e-learning module will take a brief look at the Strategic Prevention Framework and highlight essential aspects of each step: assessment, capacity, planning, implementation, evaluation, as well as sustainability and cultural competence. DECA has also created an e-learning module dedicated to delving deeper into each step of the SPF. At the completion of this module, you will find links to the entire SPF series. The Strategic Prevention Framework, or SPF, model is a planning model that works very well with coalitions, community engagement, and also prevention agencies. Being data-driven is the earmark of the SPF, and the SPF emphasizes outcome-based prevention. The SPF starts with assessment. This is where we profile the needs of the population and the resources and readiness of the community. Capacity is continually assessed and, if necessary, built before you can put a plan in place. The third step is planning. This is where you get all the right people in the room who bring perspective, using data, and using capacity. You come up with a strategic plan. Implementation is where the strategic plan gets actualized. Evaluation is the last step of the process, where you continue evaluating your progress, successes, and outcomes. Here you'll be looking at sustaining and improving outcomes and also looking at what isn't working and making adjustments and necessary changes. Then you go right back into assessment, and around the process goes. Sustainability and cultural competence are in the center of the SPF and overlap with each of the steps. Sustainability is more than just funding. It is also about sustaining positive outcomes and programs. It is about making connections so that the outcomes can live on, sustain leadership, policies and procedures, and community ownership. Being culturally competent means your coalition is aware, inclusive, and respectful of all cultures. If a problem still exists or can reoccur, it is not the time to end a strategy that is achieving positive results. Efforts need to be sustained over time and be continuous. For your strategies to be appropriate and effective, you have to take into account varying attitudes, beliefs, and behaviors. For example, in assessment, are you collecting data across the diversity of your community? And is the analysis of the data being done in a culturally competent manner? Remember that socioeconomics, education levels, generational attitudes and beliefs, and geographic features are all things to consider when thinking about cultural competence. Assessment is the profile of population needs, resources, and readiness to address needs and gaps. As we said earlier, the SPF is a data-driven process. Collecting data gives you factual information that reflects what is happening in the community, what resources are available, and where the needs are. As the first phase in a circular planning model, assessment will set the stage for further strategic planning framework steps. The assessment process includes understanding the needs and problems of your community, reviewing the resources that are required and available to address the identified problems, and identifying the readiness of the community to address your prevention needs and resource gaps. As we said earlier, the SPF is a data-driven process. Collecting data gives you factual information that reflects what is happening in the community, what resources are available, and where the needs are. There are many tools available to collect data. Many times 2, 3, or more sources of data can give you a clearer picture than just using one source. Utilizing already collected data from another community resource can be a great asset in streamlining the efforts and energy of the coalition. Assessing gaps can be instrumental in identifying the needs of the community. Remember, it is important to meet the community where it is at. Capacity is the profile of population's needs, resources, and readiness to address needs and gaps. What is capacity? Capacity includes several resources, such as the knowledge and skills of the coalition members, relationships across groups or individuals working together on the strategic plan or activities, organizational skills, legal support, money, the reputation of the coalition in the community, and enthusiasm. The more each of these contribute to the coalition's efforts, the stronger the outcomes of the coalition's strategic plan. Coalitions must have the resources and readiness to support their chosen prevention programs, policies, and practices. Your community must also have the readiness needed for implementing the strategy successfully. Increasing resources and improving readiness often go together. Building resource capacity can also contribute to greater community readiness. For example, when key stakeholders are engaged in solving problems, they often mobilize other community members, thereby preparing more people in the community to have buy-in and engage in the efforts. The more buy-in you have from the community stakeholders, the higher the likeliness for successful implementation and sustainability of the efforts and outcomes. Building and sustaining capacity along each step of the SPF process supports and strengthens all aspects of the strategic plan as well as the activities of your coalition. Your community directly benefits from a strong and productive coalition. Planning is the process of setting goals, developing strategies, outlining tasks and schedules to accomplish the goals. Taking the time to create thoughtful and thorough plans will lead to quality activities and better outcomes. Effective planning will also prevent wasting resources and time. Logic models provide a framework for implementing plans and outlines the actions needed. The logic model is a valuable tool for monitoring progress. The structure of the logic model keeps things on track and prioritizes the goal or goals. Here we have a recap of the roles of the logic model and the action plan. Action plans are assigned to each strategy and outline the specific actions required to carry out the activities chosen to address the problems identified. The logic model is the map. The action plans are the modes of transportation required to get you to your destination, positive outcomes for your community. A strategic plan usually contains a mission and vision statement, goals, prioritized risk and protective factors, development of strategies, and development of measurable outcomes. The strategic plan helps guide the coalition and builds off the work in the logic model by expanding the planning process and creating objectives for measurable 3 to 5 year outcomes. It also serves important functions by helping you create elements that are not commonly included in logic models, such as a mission and vision. A mission is what your coalition is trying to accomplish and why, whereas a vision is your hope or dream for the future. Strategic plans also help provide more of the nuts and bolts of how you are going to implement evidence-based strategies. In contrast, action plans are typically shorter in duration and more specific than strategic plans. Action plans are specific so that if leadership or roles change, another leader will be able to keep moving forward. Implementation is the process of executing the coalition's evidence-based prevention strategies. Implementation is what brings it all together based on what you've been building from the beginning with assessment. It is important to implement with thoughtful and effective evidence-based strategies. All activities implemented should be aligned with the strategic plan and support the goals of the coalition. When a strategy is implemented as its developer intended, there is a greater likelihood that its impact will be like the settings where it was first implemented or tested. Maintaining fidelity means keeping most elements of the program the same. Maintaining fidelity ensures best practice and the likelihood of desired outcome. During the first 3 phases of the SPF, your coalition conducted a needs assessment, built capacity, and developed a logic model and action plan. This will be your guide. Before implementation, make sure the best strategies and action steps to address the problem in the community have been chosen. A clear action plan, when developed in cooperation with all key partners, can help to ensure that everyone involved in implementation is on the same page and no key tasks fall through the cracks. A clear action plan includes all implementation tasks, deadlines, and the person responsible. Evaluation involves evaluating, sustaining, and improving. The final step of the SPF is evaluation. Here you compare your results with your baseline data. By looking at what has produced positive results in the community, or perhaps what has not produced the results we were aiming for, we can then make adjustments and implement. And then evaluate again. Around and around the process goes. Process evaluation measures the activities and actions you took to implement the strategies that will help you meet your goals. Essentially, the who, what, when, why, and how. Some examples of the process evaluation tools that could be used are attendance lists, meeting minutes, strategy or activity checklists. Capacity building goals and objectives are best measured by process evaluations, as are implementation targets. There are 5 basic functions of a coalition's evaluation process. Improvement helps the community build skills and improve its health. Coordination involves communication between diverse partners, knowing what everybody is doing and keeping them engaged over long periods of time. Accountability involves tracking the value added. Sustainability is a long-term goal. Celebration is important. Taking time to celebrate reminds coalition members that they're making an impact, and it reminds the community that the coalition is playing an important role. Each step of the SPF is a work in progress, including sustainability and cultural competence. The entire process is continuous and flowing, each piece vital to the overarching goals of the coalition. Additional resources to enhance your prevention work can be found on the Kansas Prevention Collaborative website. This slide lists the 8 parts of this Strategic Prevention Framework series. Be sure to check them all out and share them with your coalitions and communities. Thank you for your time, and if you have any questions, please contact your DECA Community Sports Specialist who can provide technical assistance or training.